Hi, welcome to my channel. Today's video is all about rebound therapy. So I'm sitting here with Laura McDonald, who's paediatric physiotherapist at Corsford School, and we've got some lovely footage to show you of some rebound sessions in action. And I'm going to be asking Laura all about what rebound is and how it might benefit the people that you care for. So thank you, Laura, for coming and having a chat with me and letting me film some of the sessions this morning. That was absolutely fantastic. I think probably the first thing we need to establish is what rebound therapy is.
Yeah, so rebound therapy is a movement opportunity, a therapeutic exercise, or even just for recreational use for children and adults with a wide range of additional needs. So that could be physical disabilities, learning disabilities, sensory impairments, or even autism or behavioural problems. So it's a kind of exercise opportunity for them while building in therapy.
Okay. Are there any particular maybe medical issues or physical issues that it's particularly good for?
Yes, with a lot of the children that we use Rebound for, it really helps with control of movement and tone. So some of the children have increased tone, and the trampoline really helps to sort of bring that tone down and relax them with the movement. Also, some of the children that we work with have low tone, so they have kind of not an awful lot of control over their muscles, and it really helps to sort of manipulate the movements, use the movements of the trampoline to try and get a better control of their bodies. It also helps with children that maybe are mobile but just have slightly impaired balance or issues with their balance or coordination. So again, you can really use the trampoline and the movements of the trampoline to help create a sense of balance and help the children be more aware of their body and where it is in space as well.
Okay. And one of the criticisms I've heard before about rebound is it's just a way of therapizing, if there's such a word, of trampolining, and why would you just not get a trampoline in the garden and have a go? Mm-hmm. So what is special about rebound over just being on a trampoline?
So rebound therapy, everybody that participates and runs rebound therapy has undergone very specific training. It doesn't necessarily have to be a physiotherapist or an occupational therapist, but they have undergone training with reboundtherapy.org. Which I'll give you the details of at the end. And they really use the physical properties of the trampoline to help promote different types of movement. So normal trampolining, obviously it's fun. We are just doing lots of bouncing. Rebound therapy, you're really using sort of the speed, the acceleration of the bounce to help maybe bring on movements, or you're using the sort of slow bounces to try and calm movements down. So you're really using the trampoline as a tool to help control your sessions and control the movement of the children as well.
So what sort of differences do you see in the children that you're working with after a session, and what are the visible kind of changes that you see?
Well, as I said, with regards to tone, sometimes children can be really excited, and that can cause really tight tone. You know, their muscles be really tense, really tight. And after a relaxation session on the trampoline, with the rhythm of the bounce, you start to see their muscles really relaxing. As you can see in the videos as well, we're starting off with their arms really tight and sitting here, and with the movement of the trampoline, with the gentle bounces, the arms are starting to relax down. We're also seeing that head control is really helped with the bounce too. So you can see heads leaning against our therapist there, and as with the bounces, we're becoming more engaged, and we're really looking, and we're getting eye contact. We're looking, and the bouncing is really helping to engage and bring that head control back.
Yeah. And I think there's lots of other things that can be brought into a session, like communication as well, and offering choices and things like that. So it's a really multi-discipline
Absolutely,
activity.
yeah. Said it doesn't need to be physio or OT that sort of run the sessions. Anybody can do this, and you can tailor each session for the child's specific needs. It works really well for children that maybe don't always participate really well in specific therapy sessions. The trampoline's fun, you know, it really increases their confidence of movement as well. So that's a really nice way to bring in what some kids might seem as difficult therapy or even work from the classroom or home with their communication. It's a really nice way to practice those skills in a fun and enjoyable environment for them, and sort of bringing in those skills when they're not really realising that they're actually working on them as well.
Yeah. There seems to be different bounces that you do on the trampoline, and I'm presuming they have a function?
Yes, we have various different bounces that we use, and all of this sort of you get taught in your training and what the different bounces mean. So we have a forward drive, which you can see is just 1 foot forward, bouncing singly on the trampoline. And that's really nice to start off sessions to get an upward movement. You can see that the children are getting a nice force up and down, and that's a kind of transfer of weight for them, so that they feel that for a moment they're actually weightless. They get a nice movement up, oh, I don't feel gravity anymore, and then come back down. And for a lot of the children that we're working with, they're so used to being in wheelchairs and having, even when they're out of their chairs, they still have so much postural support round about them. In their bed they have sleep systems, which are all very important, but the trampoline's a lovely opportunity for them to feel a bit weightless, and that they're having a real opportunity to explore their own movements without any restrictions.
Yeah. And the other types of bounce, there seems to be like a power bounce.
Yes, so with the forward bounce we do a pop, and that again, it's really good fun. It promotes a lot of extra movement, which is obviously what we're looking for from therapy, but really it's a lovely way to, maybe the first couple of times you're doing a session with the children, to get a nice look at what we can do here, look at the confidence you have, and get lovely head control as well up. So the pop really builds up their cardio work as well. If you imagine it's similar to you or I going to the gym, it's a workout for these kids. They're used to being quite still in their chairs, and this movement is a really good cardio workout for their organs, for their lungs, and those pops is just like a little burst of energy that helps to improve their lungs and their breathing as well. So as you can see, our pupil here is sitting lovely astride on the log roll. This is really helpful for getting a nice stretch of his leg muscles. When he's in his wheelchair, his legs are quite close together, so getting that nice stretch in a new position is a really nice opportunity for him. He's also getting a little bit of weight through his feet, and with the nice side to side bounce that we're doing here, you can see that he's actually getting the feeling of weight transfer. And he's feeling that movement through his feet, through his knees, through his hips with the bounce. He's also using lovely head control. You can see with his lovely smiles. He is engaged in the session, and he understands, he's anticipating what's coming next. He's anticipating those pops that we're doing, and he's really gearing himself up for the extra bounce. Also, you can see when we're lying down, with the relaxation bounces, again, he seems to prefer the nice side-to-side movement. We're getting nice relaxed movements of his arms. His arms tend to be quite tight into his chest, and with that movement and the weightlessness that we feel with the bounce, you can see his arms just coming up and back down again, and that's a really nice little active movement that he's doing that he maybe wouldn't be doing in his chair. So here you can see we've got quite a lot of involuntary movement in the upper limbs at the start of the session. We're just getting into the way of the bounce, and it might take a couple of minutes of nice relaxing bouncing before we're calming down. And then you can see as we are going along with the bounces, the kind of slowing down speed, the arms are actually much more relaxed, and we are much more settled into the session and able to enjoy the movement of the bounces without those involuntary movements of your body. So it's a really calming influence, this bouncing, and it really helps to focus and relax the upper limbs. The trampoline is also great for children with respiratory needs. We use it a lot in the mornings prior to our chest physio sessions, and it's again a movement opportunity, a cardio exercise. It really helps to increase their lung volumes, to get them taking really big deep breaths, and it's a lot more fun than just asking them to take big deep breaths in a physio session. So that's a really useful way for us to help loosen secretions and try and get those big coughs, and we always get a better session afterwards in our respiratory physios after we've had a good bounce on the trampoline.
Excellent. So if there are parents or carers watching this who think that Rebound sounds like that might be something that would be useful for their young person or their adult that they look after, how would you go about finding someone who could do that for you?
I guess it would be discussing with your community teams. As I said, it doesn't have to be a physio or an OT that does Rebound, but they tend to be the ones that maybe initiate the therapy sessions. So within your local area, everybody has a paediatric community team, and it would be themselves that you would ask, is this something that you offer?
Yeah.
And how do I go about getting an assessment? Obviously with Rebound there are a lot of, or there can be risks and contraindications, so you would always be checking with your GP and your medical professional that your child is safe for Rebound.
Yeah.
And then you would chat with a trained Rebound therapist into the goals and the specific targets that you're hoping to aim
Yes.
to get out of that session.
Okay.
The Rebound.org also have a list of people online, but just sort of different centres or different companies that maybe offer Rebound, so it's worth just always checking on there.
Yeah.
But my first point of call would be your local therapist.
Okay. So thanks for that. It's been a whistle-stop tour of Rebound, but hopefully it's given everybody a good indication of what Rebound is, why it's different to trampolining, and who it might benefit from it. I'll put the links down below about the website that you mentioned, and if anybody wants to know any more, contact Rebound Therapy or their local therapists.
That would be perfect.
That's great. Thank you,
Thank you
Laura.
very much.
Cheers.
Thank you.